Is there such a thing as colic?
I think there is a thing called colic. I think it's due to immature stomach enzymes. Then you're not absorbing all of your carbohydrates. The carbohydrates get to the colon. The bacteria in the colon make hydrogen sulfide and methane. This causes a lot of gas, a lot of irritability. I've seen kids who will cry nonstop for 12 hours, yet they're gaining weight, they're doing well as far as the nutrition.
Those kind of kids, I would agree, there probably is colicky.
Yeah.
But it seems much more common in the firstborn, less common on the secondborn, and almost unheard of on the third. Is that true?
I don't know.
Well, my practice, it seems that way. And I think as parents sort of tolerate when a kid cries. The firstborn, if Junior is making any noise and it's a caring parent, they react to it very quickly. Whereas if you get 3 kids, you can't put the same effort you can and you did the first kid with no other sibling. So I think some of that is from that. But is there any remedies that help a kid with colicky symptoms that you would suggest?
It seems that motion helps. Taking a child for a ride in a car, especially a car that doesn't have a smooth ride, helps. Holding the kid on top of a dryer with the motion of the dryer seems to help.
Is that sort of like mimicking what's inside the mother? Because when you walk around, the walking, the baby's going to move up and down a lot too? The bobbing?
I would think so.
That's what someone told me many years ago. Who knows if they're right or wrong. Is there any remedies that do work? Special teas?
Some people say gripe water helps, but I have found in my practice that the motion helps the most. Sometimes rectal stimulation to pass gas might help if the child is extremely gassy. I haven't found any particular teas or salves or Levsin or medications.
So basically, it's one of these things by the 3rd or 4th month it usually gets better.
Right.
And if you see the doctor in the 3rd month with the problem and the kid gets better the next day, he'll take credit for it. It might be Mother Nature doing its job.
True. And we also see a lot of formula changes going from the intact protein formula to the hydrolysates to the elemental. And if a kid has colic, it doesn't matter what formula they're on.
That's a good tip-off that maybe it is something
exactly.
like
That they've gone through all the changes and the kid is still irritable 12 hours a day. And that would be a tip-off that it's not an allergy, it's not, not a food intolerance.
What would be your justification to switch a kid from a standard formula to when it's pre-digested? What would be your criteria?
My criteria is blood in the stool. Blood in the stool means milk protein colitis. You have a colitis from the protein, and it's causing irritation to the GI tract to the point that you're actually bleeding. So blood in the stool is a definite reason.
What about a lot of crying and poor weight gain and not drinking the formula? Would that be any criteria?
I'm sure there's a lot of kids who get changed for that reason if they respond.
It's all trial and error.
Yeah.
But in spite of everything, most kids are better between the 3rd and 6th month, no matter what we
Correct.
do.